perfume is the best, it is of quality. Make it your choice, a trial will convince you. More perfume is the best, it is of quality.
I want to welcome you to another session of the Met and More Clinic. I am Dr. Media Testing. I'm Associate Professor of Orthopedic Rehabilitation. I am the CEO of Met and More Clinic. This session, we are going to be demonstrating some skills of the spines in terms of examination and mobilization technique. You can also perform the lumbar rotation technique, which is Maitland. There are 3 grades of lumbar rotation techniques. The patient lies supine, then flex the knee to 90 degrees, the hip flex slightly, then you retreat. So this is grade 1 lumbar rotation technique for Maitland. If you now extend the knee, that is grade 2. And when you now take it a downward pressure, that is your grade 3. So let's go over it again. This is your grade 1 lumbar rotation technique. This is your grade 2. And this is your grade 3. This hand is stabilizing the contralateral shoulder joint. So this is grade 1. Extend the elbow, grade 2. Take it downward, make a downward pressure. That is grade 2. So when do you use grade 1? When do you use 2? When you use 3? If the patient is experiencing a very severe low back pain, you start with your grade 1. Usually at the acute stage, you use your grade 1. When the patient is progressing and is improving and is getting to subacute level, you can integrate your grade 2, then your grade 3. So 3 grades of lumbar rotation technique according to Maitland. We have grade 1, grade 2, and grade 3. In a treatment session, it's not a rule. You don't have to wait for subacute or the chronic level, no. Even in a single treatment session, it depends on the tolerance of that patient and the level of the pain. You can use your grade 1, grade 2, and grade 3, depending on the level of tolerance of that patient. So, but for a very severe pain, as an introductory technique, you use your grade 1. Another lumbar rotation technique, which is that of Hunga, is what we call the pump handle technique. It's also a lumbar rotation technique. But in this case, you flex, you stabilize the shoulder, and you flex, almost flex to the shoulder. Sorry, to the chest. Then take it back, and you keep it there. You can also have a lumbar technique, which is in Bulgarian too. Lie on the side, for example. In this case, stabilize the shoulder, that same leg, flex it, and then you apply a sort of rotatory force. You stabilize this and you move this. You can also use this your hand as a lever to perform that lumbar rotation technique. And you can also stabilize this and rub the shoulder at the pelvis anteriorly. It's also a form of axial rotation for the spine. When you apply your lumbar rotation, what you have is sort of axial rotation, just fanning out of the vertebra in this form. When you turn it to a neutral position, the vertebra closes up. When you rotate again, that axial rotation, there's fanning out of the vertebra at that side. When you release it, it closes up. This is also a way of freeing the nerves from impingement, because when you perform that axial rotation, there is opening up of the neural canal and the nerves are relieved. When you close it by, it closes up. When you rotate again, that axial rotation, that fanning out also opens the neural canal and the nerves are free. So as you do this frequently, you are actually freeing the nerves from impingement.